As you could see on Canvas, I posted 3 videos. They're YouTube videos that you can watch to further define the role of OT in primary care. We're going to further review this now. So the question is, how can OT expand into the primary care arena? OTs can focus on self-management training for chronic and psychiatric conditions, management of musculoskeletal conditions, including pain. They can be a self-management educator, safety and fall prevention interventions, driving and community mobility resources for older adults, redesigning of physical environments, including the home environment, health promotion and prevention across the lifespan and lifestyle modifications, individual and community education and consultation to other health professionals, family and caregiver support, research, education, and policy, and other interprofessional and intra-professional opportunities. These are all areas that you will review throughout Older Adults 1 course and Older Adults 2 courses. Here is a graphic pulled from the OT Practice Framework 4 about self-management and health management. So just to go over the specific occupations that OTs can be playing a role in within this health management scope and domain are the social and emotional health promotion and maintenance, symptom and condition management, communication with the healthcare system, medication management, physical activity, nutrition management, and personal care device management. Remember, you're always coming through all of these interventions with an occupational therapy lens. You should always be focusing on function. What are the person's desired occupations? What do they need to be able to do in order to achieve those desired occupations? So for example, the physical activity intervention, many people sometimes get confused. They can look at an OT in a rehab gym, see them doing some arm exercises with the patient and say, well, that looks just like physical therapy. But the real thing, the real focus needs to be on why are they doing those arm exercises? What occupation is the goal at the end of those for the person to be able to complete with strengthening their arms? So for example, if they're strengthening their biceps, maybe their goal is to be able to pick up something within their home. Or if they're strengthening their triceps, their goal is to perform a depression lift transfer out of their wheelchair. And it should always, the treatment session should always end with performing the actual occupation, right? We shouldn't just be doing upper extremity exercises during a treatment session as an OT. We should always round out the session with making sure that we bring it back to why we are doing this by focusing on the occupation. The importance of the interprofessional teams in primary care for older adults. It allows for coordinated and comprehensive care. It's more cost-effective, and it has more of a focus on prevention, pre-rehabilitation, and health promotion. Telehealth service delivery models. So some benefits of a telehealth service delivery model include increased access to services, especially for clients who live in remote or underserved areas, improved access to specific providers and specialists otherwise unavailable to clients, prevention of unnecessary delays in receiving care, and sharing of expertise between practitioners through remote consultation. So it's important to remember that we can monitor individuals by using information and communication technology. Telemonitoring, or remote patient monitoring, is commonly used in the medical model for chronic disease management and involves the transmission of clients' vital signs, such as blood pressure, heart rate, oxygen levels, and other health data, such as blood sugar levels, weight, ADL performance, and fall events, for review by a clinician to assure more timely monitoring. This type of monitoring can prevent health crises, emergency department use, and hospitalization, and can promote health and wellness. OT practitioners may work on interprofessional teams using telemonitoring for chronic disease management, for instance. Practitioners may use ICT, information and communication technology, to monitor a client's adherence to an intervention program, ADLs, cognitive changes, and fall risk. Wearable and home-based sensor monitoring systems are being examined for efficacy with older adults to aid in recovery of the ability to effectively and safely perform ADLs following hip fractures. There's a Pohl et al. 2017 article studying that. Telemonitoring can be a tool to enable occupational therapy practitioners to assist clients in achieving desired outcomes. Further, telemonitoring can give occupational therapy practitioners insights and information about issues and concerns with performance in clients' natural environments. Telehealth services include intervention, consultation, and like I was just discussing, monitoring. Technology availability and options for occupational therapy practitioners and the client definitely include increasing safety, effectiveness, and quality of interventions that can be provided through a hybrid model. They focus on the client's choice about receiving interventions by means of telehealth, the client's desired outcomes, including their perception of services provided, reimbursement, and compliance with federal and state laws, regulation, and policy, including licensure requirements. Teleconsultation is a virtual consultation that includes the remote provider and the client with a caregiver as appropriate. Remote providers or local providers, including therapists, durable medical equipment vendors, prosthetics, and physicians, with the client and caregiver as appropriate, or remote providers and local providers without the client present. The American Journal of Occupational Therapy includes an article that discusses teleconsultation using ICT to obtain health and medical information or advice. Teleconsultation has been used to overcome the shortage of various rehabilitation professionals across the United States. For example, an occupational therapist can remotely evaluate and recommend adjustments to a client's prosthetic device using computer software with video conferencing capability and remote access to a clinician's computer screen despite the physical distance between the expert clinician and the client. This is a 2011 article by Whelan and Wagner. Similarly, Sheehan, Schmeller, Brianza, Sapatono, and Parmatano in 2008 demonstrated positive outcomes associated with teleconsultation between remote seating specialists and a local therapist for evaluating wheelchair prescriptions. In addition, teleconsultation can be used to conduct home safety and home modification evaluations, prevention and wellness services, ergonomic consultation, pre-administration consultation for patients undergoing total hip and total knee replacements, and to facilitate support groups for people with chronic conditions. In the fall, you'll be completing an aging in place assignment where you have the opportunity to administer a home assessment via telehealth. We'll discuss this definitely more in the fall, but this is a perfect example of teleconsultation for individuals that might not otherwise have access to this type of service. Some considerations for telehealth. You always need to be considering what are the regulations, both federal and state. Medicaid has covered telehealth services in various states, but not all states. During COVID, OT services were now reimbursable through Medicare. Ethical considerations are definitely should be at the forefront of your mind always. You should be thinking, is this appropriate for the client? Are they going to truly benefit from a telehealth service, etc.? And like I had said, reimbursement and billing. Health management and maintenance. Managing one's health and participating in routines and habits that foster health promotion and quality of life. These may include prevention, management of chronic diseases, development of specific skills, or health promotion and wellness activities.